We want to get the latest updates from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. Alex Garza is also Chief Medical Officer for SSM Health, joins us live this afternoon. Dr. Garza, and the numbers in your task force report this afternoon, we're seeing new records every day, especially with hospital admissions. So what does that signal to you, and should we be concerned?
Well, I think it signals that we still have a lot of sick people out in our community that are becoming ill enough that they require hospitalization. So as you mentioned in the previous segment, it's a very fast spreading virus. And we have a significant proportion of the population that's unvaccinated, which is primarily who this is affecting. And so that's why we're seeing these record number of admissions and hospital census in our metropolitan area.
And you talk about the people the Omicron variant is affecting. Today, the task force, though, did report more than a third of the people in local hospitals with COVID are vaccinated. What does that number say to you? Does that concern as well?
So what it tells me is that Omicron has an ability to evade some of the immune system responses from vaccination. But I think it doesn't tell an adequate story. And the reason for that is when you think about the significant number of people that have been vaccinated, a very small percentage of them are ending up in the hospital, whereas a much larger percentage of the unvaccinated are ending up in the hospital. So it's without a doubt that vaccine protects the individual from a very poor outcome or from serious illness from the Omicron variant. So I wouldn't let that 33% dissuade anybody from getting vaccinated.
And we mentioned this a little earlier as well. The U.S. Supreme Court today blocked a federal mandate for large private companies, but also ruled almost all hospital workers would have to follow a government mandate to get vaccinated. So talk about what that means and what that ruling means for our medical system here locally.
Well, most of the medical systems here locally, and I think most of the large medical systems and the smaller ones as well, have been requiring vaccinations for healthcare workers for quite some time now. And so this is really no different than the vaccine requirements that we have for other diseases such as hepatitis, and we require influenza vaccinations every year. So really it's just reaffirming what healthcare systems already do, which is making sure that we can protect our employees, but also protect our patients, because certainly we don't want ill people coming to work when we know they're going to be taking care of a susceptible population.
And through this pandemic, we've all heard the phrase of returning to normal. Everybody wants to get back to normal. But yesterday, Dr. Anthony Fauci said that we will not wipe out COVID-19, but hopefully control it. So what does that mean? And do you see it as a shift in what we've been hearing from the federal government to this point?
Yeah, so, all pandemics come to an end. And so the question then is, when is that going to occur? And so I think what Dr. Fauci was saying is eventually we'll get away from this acute phase, the pandemic, where we have record number of cases and hospitalizations, and it'll become what's called endemic, which means it's always going to be circulating around the community, but it won't be causing these large swings of really sick people. It'll become much more seasonal. We'll still see cases, but they'll be controllable, and there won't be as many susceptible people out in the community to catch this disease and get really sick from it.